Hi, I'm Ken Grant with the Kelly Ross Pharmacy Group, and have you heard about our in-home medication coaching initiative? To learn more about it, we brought in Jeff Meir, who is our clinical pharmacist and also works within our CPI group, to learn more about it.
In-home medication coaching is exactly what it sounds like. We love to go into the patient's home, assess their use of the medications, see what barriers they have to any of the medication use, such as maybe access or education. Maybe they don't understand their meds very well, especially when they're leaving the hospital. They may have very little understanding and be very confused about their medications. Our ultimate goal really is to have improved patient outcomes. Currently, we get all our referrals through two partnerships that we have in the community right now, and that includes Aging and Disability Services through Medicaid, as well as our partnership with the VM Cardiology Clinic over at Virginia Mason.
Pharmacist is a great pairing for us because that is someone that knows medications, is very able to manage those medications and help people with those issues so that they can make sure that they're set up well at home.
So currently the nursing staff over at the cardiology clinic assesses each patient to see if they're eligible for our program. After that, they'll fax us a referral process, a referral request, which we'll process and then go see the patient.
So by having our team and the pharmacy team identify the patients prior to discharge, we're able to identify those people and work together then to contact them within the first few days they're home, and the pharmacist then gets in their home immediately and really helps them get set up for success, because there's so many barriers and so many issues that can happen. So the communication between us, we've been able to get the pharmacist on our electronic medical record so we could communicate in real time through that to our clinic and the docs and with the pharmacists. It's just been a wonderful partnership.
See, the amazing thing about this process is going into each patient's home and the incredibly different things you see. Some patients you'll go in and often they'll have medications in many different areas. They're storing them in different areas. They have very little knowledge of each medication, and that's definitely something we can provide while we're there. And after we gain all that information about the patient in their home and in their comfort zone, we can take that information, put it all together, and then coordinate with all the other healthcare professionals, like the physicians they're seeing, the nursing staff they're seeing, and to provide those recommendations.
So one of the benefits of partnering with Kelly Ross has been that we thought this model of using pharmacists would be a great idea because of their skill level in working with medication and medication reconciliation and compliance, and doing that in the home setting, which we thought would be a really important way to help with that transition of care.
The two most rewarding things about this program are seeing the reduced readmissions that we're having an effect on to the hospitals, as well as seeing the joy in the face of the patient each time they have an understanding of their medications that they didn't have previously.
I didn't believe in the meds. You know, I was like, I don't need to take meds. I'm going to be okay. You know, meds give you this, or meds give you that, or your friends say, I'm not taking meds, you shouldn't either. And, you know, I bought into that for a while, you know, before a pharmacist came into my life and sat down in a humane way and said, Glenda, this is this, and this is what this is going to do for you. You know, and the way they said it, I'm like, I'm a believer, you know. So, and I tried it, and it was like, whoa, that's true. You know, if you take that med, I wasn't taking them right. I wasn't taking them to build up enough in your system. I wasn't consistent. So 1 week I'm having a good week, I take them, and the next week, bad. And the pharmacy had to come and say, that's why.